I'm here today with Dr. Christopher Crow, founder and CEO of Catalyst Health Network, to discuss primary care reimbursement. Dr. Crow, thanks for joining me today.
Hey, it's great to be here with you all. I'm a longtime reader of medical economics.
What's wrong with how we pay for primary care today?
Well, in a short sentence, you could say that they're incongruent incentives. And then to unpack that a little bit more, you'd want to say, well, what are you trying to incentivize? And so you have to have some agreement there that we're trying to incentivize what people have called the triple aim and maybe even the quadruple aim, which is how do we get a better clinical outcome for patients, a better experience for patients, a lower cost of care or a more valuable cost of care for the system. And then the providers that are providing that care have to have a satisfaction level with the work that they do as well. And so to align those incentives would be important to actually, if those are the outcomes you want. Right now, the way fee-for-service works for primary care, there's an incongruence with how that's paid for the care that's delivered if you want to actually achieve those outcomes. Let me unpack that a little bit more. Right now, fee-for-service means that you have to come into my 10 by 10 room exam room for me to actually get reimbursed for caring for you. Now, with COVID, we've certainly opened up the telehealth piece, and we'll get to that in a minute. But the traditional issue of fee-for-service is it requires a 10 by 10 exam room visit to actually get reimbursed. And that does things very much against, that's not the only way or the best way to get better clinical outcomes. It certainly is not the only way or the best way to have a good patient experience. It is the only way to have cost right now. Reduction is this one episode. And then for providers from that standpoint, you've heard about the burnout. Burnout is going up, up, and up for the physicians. And so it's really an incongruent model. Why it's incongruent is because it's reactive. If you want good primary care is a relational-based care model. Physicians and their patients in primary care stay with each other for years. It's not an episode. It's not a one-time thing. It's potentially a multi-year, multi-decade, multi-generational, lifetime relationship. And therefore, it should be paid more smoothly over time, what we call proactive payment or prospective payment, rather than this reactive care. If you're only going to do reactive care, then you're not going to get all the benefits of encouraging people to get good preventive primary care. And so the relationship of fee-for-service is such that it doesn't allow for the proactive nature of care delivery that primary care is trained to do, trained to take care of the whole person. But the payment model requires a 10 by 10 in-person visit with that physician. So those really need to be unlocked from each other.